Most of us know about heart attack because there is a pain which is involved in it, but stroke, there is no pain associated with it. It's mainly the deficits. We had a patient, he came out of the gym. When he sat in the car, he felt a little dizzy and he has ignored it. He thought it was because of the workout which he has done. So even though he came to the hospital, it was just half an hour late. See, every minute the cell dies because there is no oxygenation to the brain when there is a stroke. The earlier they reach hospital, the better will be the outcome. He is doing fine, okay, but still when you do an MRI, you can see one part of the brain where there are cells are damaged.
You are tuning into Fever 104 FM with me, Cheyenne, on the Superhero Show. And right now on the show, it's time for Health Waves by Kaveri Hospital, Marathahalli. With me in the studio is Dr. Tejas Rao, consultant neurosurgery and endovascular intervention. I've spoken to a lot of doctors from Kaveri Hospital, Marathahalli. This is the first time I'm speaking to you, sir. So thank you so much for coming to our studios.
Hi Cheyenne, pleasure.
Okay.
I'm also happy to be here.
Oh yeah, I wish to have you, I hope to have you much more often in the studio for that matter. Okay, so today we'll be talking about strokes, right? And a lot of times people like us confuse of heart attack and stroke. We know what the heart attack signs look like. But what about stroke? Most people don't realize when it's happening. So can you tell us a little bit about the signs of stroke?
So it's basically what happens is when there is a blood flow to any part of the body, when it gets interrupted,
Right.
the oxygenation to those cells will stop. So that is heart attack or stroke. Both are the same. The blood flow to that organ is interrupted. Most of us know about heart attack because there is a pain which is involved in it. Because people tell I have pain in my chest, so immediately they rush to the hospital.
Right.
But stroke, there is no pain associated with it. It's mainly the deficits. Like there will be slurring of speech, there will be arm leg weakness which starts. So that's when the problem comes. The awareness is much required when we talk about stroke. So it's the basic pathology is the same, but the problem is in different organs of the body, and stroke is without pain.
All right. So what are the signs that people should look out for if they or somebody they know is having a stroke?
So it's mainly there is an acronym which is BE-FAST. So B is balance. If someone loses balance or having a vertigo, I signs is for E. E is for eye. That means there is no vision is lost or a part of the vision is lost if they complain about these things. And next comes the fast. F is facial deviation, arm weakness, slurring of speech, and next will be don't waste time. T is for time. So if you have all the symptoms, please don't waste time.
And
this is a classical thing which is described. Everyone will be aware of it.
Right.
There are silent strokes also when the important parts of the brain are not affected. Then they may not have the classical symptoms.
So we got to know that the signs to look out for when a person or anybody they know is having stroke is BE-FAST. But how does a stroke even happen? So 1 minute a person is fine and the next minute we notice a slurring of speech, maybe a partial face deformity on one side. So what exactly happens in the body?
As we are in Bangalore, we can correlate with the traffic, which is there. So what is a traffic jam? So there is a block in the continuity which is happening. So same thing happens in the brain. So the blood is flowing through a stream. There is a block in the continuity. So what happens? The blood doesn't flow to the part of the organ. So in stroke, it is the brain. So there is no blood flow to the brain. So there is no oxygenation which happens. So when this doesn't happen, it is the race against the time.
So how do these block form? Is it fat block like cholesterol and stuff like that?
So there are two, I'll come from the basics. It is two types of strokes, which is ischemic and the hemorrhagic. Okay. Ischemic is blocking in the blood vessel. Hemorrhagic is the blood vessel which ruptures, it bursts, and the blood will be spilled into the brain cells. So the one which I was talking about is the ischemic stroke, where there is a block. Block can happen, as you told, because of the cholesterol, which is deposited in the blood vessel. That can be due to high cholesterol levels, diabetes, hypertension, etc. And other one is an embolic stroke, which is there is a clot which is there in the heart. When the heart pumps, the clot will go into the brain. It can block the blood vessel. So these are different types of strokes. So it can be a cholesterol in the vessel, or it can be a clot from the heart which goes to the brain.
So we were talking about a myth that only elder people, older people, they have strokes, and while a 30 to 40-year-old individual probably does not. But we are now saying that even they have strokes. So what do you say? Is are strokes only seen in older people, or anybody can have it?
You need not be old to have a stroke. You people who are not bothered about their health will definitely have a stroke. That's how it is.
Oh.
Means. So nowadays, of late, we are seeing too many strokes which are happening in younger individuals, which is reaching almost 30% in India nowadays. Whatever strokes we are seeing, of which 30% are seen in younger individuals. That's what I mean.
Oh.
So what happens is, so it's basically the factors which affect these things. One is the lifestyle, lethargic lifestyle, and smoking, alcohol, obesity. So these are the things which will predispose to stroke, which is very commonly seen in younger individuals nowadays. So that is the reason we are seeing too many young strokes. When I was a resident, we were seeing strokes only in elderly people. It was above 60. Now recently we have treated a patient who is 30 years old. So it is now age is not the thing. It's about the lifestyle. If you are, and how frequently you get your health checked. Are you a diabetic? Are you taking medications properly? Are you hypertension? Are you taking? So these are the factors which affect the outcome.
Now, let's say somebody is brought to the hospital on time, according to the BFAST acronym and the symptoms and the sign. What are the treatment options for a person who's just gone through a stroke or is going through one?
So everyone will be aware of this golden hour, which is around 3 to 4.5 hours. So when they reach hospital in this time, so first what we do is, it's the clinical examination which happens first. Detailed clinical examination. Is it really a stroke? What type of stroke it is? Then we decide on further investigations. So blood investigations and the imaging. Imaging can be CT scan or an MRI. Based on the condition. Sometimes we do both. So based on the condition of the person who has come, we decide what is to be done.
Right.
So once we get all these things, we have a team of doctor who are specialized in stroke care. So we all sit together to decide what is to be done next. So sometimes we just give oral medications. There is something called as a clot burst therapy. We give injections to burst the clot which is there in the brain. And third one is the endovascular intervention. We go into the vessel and we retrieve these clots. So we decide based on the investigations. This is how we go ahead.
All right. And can I ask you this question, that the treatment options for stroke, are they more or less successful? Or, I mean, I'm just trying to understand from a person who doesn't know much about strokes, or is the success percentage of treating a stroke patient less?
No. So now technology has advanced so much. So the same question, if you had asked me a few years back, I would have told you no, there is not much of hope. But nowadays, the awareness is there among people. And second thing is, technology has also developed a lot. So whenever people reach hospital in time, the earlier we take out these clots or the pressure on the brain, so the faster will be the recovery. And it is much better in an younger individual.
So what does a good outcome really look like in a patient who's just had a stroke?
So there are multiple factors which define the outcome.
Right.
That can be the age, the severity of the stroke, or it can be the time at which they reach the hospital. All these factors will decide the outcome. It's not one factor which tells the outcome. So what happens is, so a person, best case scenario, it's a mild stroke. He reaches hospital in time. We have done the appropriate therapy. Then it will be like 90 to 95% very good outcome, which will happen. And the other thing is, if it is a severe stroke, they don't reach in time, we can see around 50 to 60% recovery. It is a team approach. It doesn't end with the initial management or acute management of stroke like endovascular intervention or a clot burst therapy. Further, there is something called as neurorehabilitation, which happens, which is physiotherapy. And the family's involvement in these patients is very, very important. So there are family members who get involved in the care. The outcome is much better than a person who is left just with the hospital with the physiotherapist.
All right. Can you share a real case? someone whose stroke was not obvious at first, or someone who got misdiagnosed, and at what happened after surgery or intervention?
So I have a interesting case. So we had a patient who had reached hospital, obviously in time. But what happened before that was he came out of the gym. When he sat in the car, he felt little dizzy, and he has ignored it. He thought it was because of the workout which he has done. When he reached the house, he started slurring. So that's when he realized something is wrong. So initial the dizziness, which is the first part of B fast, the first is imbalance.
Right.
Whether it is dizziness or when you're swaying while walking, all these signs should trigger. He could have directly come to the hospital. He drove to his house. So even though he came to the hospital, it was just half an hour late. So see, every minute the cell dies, right? Brain cells die because there is no oxygenation to the brain when there is a stroke.
Okay.
So the earlier they reach hospital, the better will be the outcome.
Okay.
Right? He's doing fine. Okay, but still when you do an MRI, you can see one part of the brain where there are cells are damaged.
So, okay, he's doing fine now.
Yeah. He's doing fine now. The initial part he did not recognize it that I have a stroke. After reaching home, he realized it. Yeah, my speech is not clear. So I think this is a stroke. He's an educated person, so he came to hospital in time.
So, doctor, so stroke, I hear, isn't always about a clot or bleeding. Can something growing inside the brain, like a tumor, can that cause stroke-like symptoms or stroke?
So stroke is something which happens all of a sudden.
Right.
So I'm fine, I'm walking around, suddenly I'm developing a weakness in the hand and leg. So it can be due to the blockage of the blood vessels. As I told you earlier, there is something called as a hemorrhagic stroke. That means a blood vessel can rupture. So it is seen in conditions called as aneurysms in the brain. It is seen because of arteriovenous malformations in the brain.
Right.
So there can be a rupture of these blood vessels which can have symptoms like an ischemic stroke. This is called as a hemorrhagic stroke.
Okay.
Sometimes we can see a progressive stroke. So where they'll have, today my hand is weak, tomorrow it is even worse than what it was today. So this happens, we have seen these conditions with tumors too. And there is something called as hydrocephalus where there is expansion of the water content in the brain. So these causes pressure in the surrounding nerve cells. So these also can mimic stroke.
All right. Now, if someone's had a stroke, what are the chances of it happening again? Can it be prevented, or is it always going to hang over them?
So it can be prevented. So a person has a stroke now, he has been completely treated and he is cured. So the first 90 days are very crucial. So a second stroke can happen in the first 90 days. So we explain all our patients that be careful for the next 90 days. If there is any sign, any doubt, please come back to hospital, please visit us. And accordingly, we schedule our OPDs also so that we can frequently visit these patients and see them how they are. The other thing is sometimes there is something called as a transient stroke. So people develop symptoms of stroke, they are fine in 5 minutes. That's where the problem occurs. They ignore it. Once I had a stroke and it has completely recovered. So they ignore those symptoms. They don't reach hospital. So I would advise people who are having a transient stroke kind of symptoms, please go to a nearest center, visit the doctor, take the consultation. Just few medicines can prevent a recurrent stroke, because first time you may be lucky, second time it can be a disastrous condition. So whenever there is a doubt that there is a stroke, visit a hospital, meet a neurologist or a neurosurgeon, you will get it treated.
All right. So before I let you go, sir, one last question. If someone is listening who just got diagnosed with a stroke, or if they're watching a loved one struggle, anything that you want them to know?
So it is stroke is just a pin-sized clot which is at the wrong place.
Right.
That's why they are developing the symptoms. Nothing to panic. Reach the hospital in time. Take him to the hospital, whether it is a stroke or not a stroke. If you have a doubt, please reach the hospital emergency. You can call the ambulance also, and it will be taken care of. Even if it is a severe stroke, we have seen people who walk back home.
Okay. All right. So that gives a lot of hope, actually, and a good note to end the interview on. Dr. Tejas Rao, thank you so much for taking time out and coming to our studio. We got knowledge about a really serious thing, and I must compliment you that the way you explain things to us is very simple language, so it is very easy for me to understand, and I'm sure for people who heard it on radio, it was easy for them to understand as well. So thank you so much once again.
Thanks, Shane. Thanks a lot.